Efficiency Unlocked is hosted by two tech-savvy physicians and dear friends of mine, Drs. Carewe and Dale Gold, who are experts in using technology to automate routine tasks and increase efficiency in everyday and business life. Let's see what they have for us today.
Stay tuned for this series of episodes where we'll be discussing the game-changing impact of AI in the realm of patient care and physician well-being.
Get ready to unlock efficiency with NerdMDs.
Efficiency Unlocked.
If you put a software that don't work well into the hands of a physician, they will try once, maybe twice if you're lucky, and then you're out. And so we learned a lot on how to where we should really focus on something very narrow first, deliver it really well, exceed their expectations on that, and then then they will proactively talk to us and say, okay, now I would like my AI to do this and that, and this is our current roadmap. We're just listening to what they ask us for.
That was Alex, the co-founder and CEO of Nabla. My name is Diana and I'm helping Adam this week with the introduction, as he has a bad case of laryngitis and can only whisper. Alex was just talking about trust and how critical this is for a healthcare startup. If you miss that initial trust opportunity, it is very difficult to regain it again. Let me tell you a bit more about Alex. Before Nabla, Alex led engineering for Facebook AI research. He joined Facebook through their acquisition of Wit.ai, an AI platform he co-founded in 2013. Prior to Wit.ai, Alex was the founder and CEO of Virtuoz, Siri for the enterprise, virtual agents, which was acquired by Nuance Communications in 2013. Alex received an MS in computer science from École Polytechnique in Paris. Alex is a firm believer in the potential of AI to support healthcare professionals in the delivery of empathetic, predictive, proactive care at scale. One of his mentors is Yann LeCun, VP and Chief AI Scientist at Meta, who is also one of Nabla's advisors. The NerdMDs are pleased to have Alex join the show today, so let's get to the fascinating discussion with Adam and Alex. We hope you enjoy this episode.
Welcome to the show, Alex. Happy to have you here.
Thanks very much, Adam. Very happy to be here.
Awesome. Do you have anything to add to that amazing intro and history for yourself that you want to share off the bat?
Amazing intro, Adam. So I have a lot of experience with AI, about 22 years of doing AI and companies. So this is my third startup. But when we started Nabla 4 years ago, we knew nothing about healthcare. At least we knew nothing. Mm-hmm. And so we made a decision early on to start full stack and to create our own clinic. So we have our own physicians, our own patients, and we learn from the inside by ourselves. And so for the first 2 years of Nabla, we actually ran a clinic in 2 countries in order to learn. And so I love this. How we started the company by doing things ourselves.
No, that's so cool. I mean, your history in that intro that I just presented to the folks. It's interesting. All that stuff you were doing before has really kind of led to this moment in healthcare, which is really quite a transformational, I'd say, pivotal moment for healthcare. So it's exciting that you took your experience and knowledge and shifted to healthcare. I know I personally thank all the founders that have done this, and it's going to make healthcare better for everyone across the world. You kind of got in a little bit to, your intro went into a little bit to your origin kind of story, but can you share with us, your journey and inspiration for why you really thought you wanted to pivot into healthcare, and you can allude to a little bit about yourself and even that kind of starting of Nabla.
Yeah. So after my first 2 startups, I was with Facebook. Very, very interesting company, very smart people, and we had a lot of freedom to do many things we wanted. But after a while, I don't know if you've seen the Silicon Valley TV series where they have the vest and arrest at Google, which is really in the series. And so people are just doing barbecue on the rooftop waiting for their vesting time to end. And so after almost 4 years on Facebook, I say we because it's not just myself, but also a few people around me, my team, were feeling, okay, we should really try to do something useful. We are all the AI, all the research in AI is most of the research is public, is open source, is published in scientific journals. And but back then in 2018, not so many people in the world really understood this research and the impact it could have on the real world. And so I felt that there was a bubble of scientists, a few thousands maybe in the world, and many of them were working for Google or Facebook, doing incredible stuff, publishing, it's open, but it's so technical and so hard to get that it's not really used in the real world, or maybe just to make some people clicks on ads or stay more time on web, on mobile apps. So not really good. And on the other hand, in the outer world, you have entrepreneurs, you have product people, but they are not really aware of this research. And so we thought, okay, we can do something. We are at the intersection. We know how to build products. We know how to build startups, and we have access to this research and to these scientists. So we should really do something. And actually, my boss Jan LeCun encouraged me to leave Facebook and build products, useful products based on this research. And so then we had two candidates, healthcare and transportations, where we thought the impact would be really great. And so I started to meet many physicians, visited hospitals. I attended to hundreds of consultations with actual patients. And I was thinking, okay, we'll do very sophisticated AI to do better diagnostics, automated doctors. And then after just a few weeks, I realized, no, doctors are wasting their time doing admin stuff, very, very basic, filling forms, paperwork. And so we should really start with this before we do like the Star Trek science fiction movie kind of healthcare. There is so much as an engineer when you look at how physicians work. You cannot stay seated and do nothing. It's too tempting to try to improve the processes and everything. It seems incredible that people like you, who spent more than 10 years studying medicine, and cost a lot of money to your employers, eventually spend half of your day doing clerical work. It's just crazy. As engineers, it was impossible for us not to try to do something here.
No, that resonates so much with me and, my buddy Dale, obviously we weren't trained as engineers, but, I think many of the way physicians are trained, it's kind of similar in that like engineering thought process. And, that's why we stumbled into this space, to try of informatics, which, honestly, when we started, it wasn't even called informatics. It was just kind of like the doctors who really like technology or the nerds in the medical group. But I think it's evolved, into, a way for, physicians, nurses, pharmacists, different clinical folks that have this interest in technology, really try to help improve, exactly what you just said. I mean, there is such low hanging fruit that like you could just optimize like very simple processes and make it so much easier for people. And, informatics, we use our tools that are kind of given to us or a part of us, like the tools that are available in the electronic health record or other systems, but, being able to augment it with, amazing technology is really, really promising. So no, that's, again, I thank you for making the pivot to healthcare, because with more of you doing this, it's really going to lead to ultimately better outcomes. I think patients are going to be seen quicker and more accessible at the time that they want. And like you said, physicians aren't going to be burdened with the multitude of administrative tasks that have been laid on us with the advent of the digitizing of healthcare. Can you allude a little bit to like, you said some of this already, but like, can you allude a bit to where this has kind of led to your specific why and how that shaped the vision of the company?
Yeah, in the long term, we hope we can help physicians to be better physicians, with diagnostics, with clinical decision support, things like that. But what I understood, I think, is that to earn the right to work on that, you must first solve the basic problems, and then you can talk. And so we made this decision early on to really focus first on these things, earn the trust of our users who are physicians, and really draw a very clear line on what we don't want to do today. We learned a lot from our first days working with physicians at our own clinic, that you've been burned by many things that don't work or don't work well, and so you're very tired. You don't have time to learn new things. You've been you have a lot of pressure, and so we learned a lot that we should be very careful to have reasonable claims, deliver very high quality stuff. Don't deliver, in my world at Facebook, where our motto was move fast and break things. I think this is an opposite culture in healthcare, where if you put a software that don't work well into the hands of a physician, they will try once, maybe twice if you're lucky, and then you're out. And so we learned a lot on how to, where we should really focus on something very narrow first, deliver it really well, and exceed their expectations on that. And then then they will proactively talk to us and say, okay, now I would like my AI to do this and that, and this is our current roadmap. We're just listening to what they ask us for. But very important. I think healthcare is so complicated. It's very easy to have good ideas, but very hard to deliver them. There is a cemetery of startups who died, waiting for a pilot to move on with a big health system. And we tried from the beginning to avoid that fate, and by trying to narrow down on something very, very precise, which is today clinical documentation, but it's already starting to expand now that we have won this place. And so, it's important for any startups in any industry to start quite narrow, but it's more important yet in healthcare.
No, that's super well said, and honestly, it's very timely because I've met several even physicians who have had startups that not necessarily in the AI space, but they shared that same sentiment that it's really wise if you're going to do that to pick that narrow start to the path, because if you start too big, it stretches you too thin, and it can lead to failure, like you said. So I think that was a great move. Let's pivot a little bit now to kind of the impact of the product and generative AI in general. I guess, can you share a bit? You've said this, that it's obviously focusing on kind of the ambient notes at this time, but can you share how this product does actually use generative AI in creative ways to decrease that administrative burden to physicians, other care delivery clinicians, care teams? And then do you have a story or a customer, that you don't have to name who it was, but that you could kind of share along with that?
Yeah, sure. The product is very, very simple. As you know, they come to a visit with their phone for an in-person consultation. Put the phone on the table in somewhere. They don't need a computer anymore, don't need a screen or a keyboard. They just ignore it, press start on the phone. And so our Copilot will listen. It doesn't record, but it will listen to the consultation. And based on that, we'll create all the documentation, the coding, and pilots, autopilot or automate most of the workflows, the admin workflows, like writing referral letters or updating the EHR and everything that come after the consultation. So what they do now is the biggest change of experience is they close the chart in real time. They close the chart before the next patient. And so it removes the mental load to remember something or write down something until later in the night after you put the kids to bed. You have to go back to your charts and close them one by one. And so it's really completely changed this experience. at one of our biggest US customers, they have a program called Done by 6, where they try to help every physician be done by 6, and they rename it Home by 6 after they use generative AI.
Awesome.
And so it's what we had in mind when we started was the gain of productivity, which is 1 to 2 hour per day per physician. But what we didn't see was a gain in terms of relief of stress and limiting burnout and feeling good to provide care. And this is how these people envision care before, when they started to study, before they actually started to work. They saw this part of care. They didn't see the admin and the charting part. And we are trying to remove it and make their life more consistent with what they had in mind when they started their career. And then we have interesting stories of how physicians change. So, for instance, they learned from using Copilot that when they do physical exam or measuring vitals or doing like an exam on your knee, for instance, if they don't say anything, the Copilot cannot know what they did, so they will have to document it manually. But soon they realize that if they verbalize the exam, the Copilot will capture this information and chart it correctly, so they don't have to do it. And so they will verbalize more and more. And then suddenly we realize that patients love when their physicians verbalize more, especially when they don't understand what it is about, like very, very technical terms. They feel, wow, it's very complicated. I must be like an important patient, and they are doing technical stuff on me. That's good.
Yeah.
And so we had this story from several physicians that realize that verbalizing the consultation has a huge impact on the patient engagement. And the patients are very happy too. This is something we never ever saw coming before people starting using it.
No, that's fascinating. Actually, that's very intriguing, because I think, there was the advent of like having open notes, changed a lot in medicine. That's pretty much the standard in the United States now for the majority of health systems, if not all. It's actually mandated in many ways. But that's interesting about the verbalization, because I think back when I was in my training for family medicine, I did a rotation at a very large orthopedic group here in Denver. And, their practice was extremely efficient in that each orthopedic surgeon in the clinic had 2 medical assistants, one in each of their rooms that they were going back and forth to. And they would literally verbalize, what you just described. They were verbalizing to that medical assistant who was sitting at the computer. And they were saying, right elbow, 90 degrees, this much internal rotation. It was like all this technical jargon. And I do remember actually hearing patients say that they appreciated that. And that's just a super interesting tie-in, because that was 13, 14 years ago that I was doing that. And obviously way before this technology was even a glimpse of what was coming. But that's super, super interesting. And I think the other thing, you mentioned, which I think is worth chatting about, is, there's a principle, and I can't think of exactly what the name of it is, but I have a physician colleague who talks about this, because we do in my health system, we do an internal optimization program for our clinicians. And we take them off site for 2.5 days, and it's pretty intensive, but the whole thing about it is really just improving their proficiency, which will ultimately lead to better efficiency. So they can, our motto is more time for what matters. So like that individual person can kind of, use that to whatever they want. Like you said, if they want to be home for dinner, if they want to be home by 6. But what we talk about there is like, as you get more efficient, you actually fill that space with other things that need to be done. Like you handle things quicker in your in-basket, or you are able to talk to your nurse or someone else in the office. And I think it gets to your point where there's like this subjective improvement that happens with these types of tools. And when you And that's, I've shared this many times, but I've been telling our docs for years that this day is going to come, like where you can walk into a room and you won't have to touch the keyboard. And they usually look at me and go, yeah, right. That'll happen when I retire. And it's just so exciting that this is here now. And, just thanks again for sharing. I appreciate that. And those stories were spot on. So let's pivot now to, a little bit, so you can kind of talk about where you see Nabla being kind of a differentiator. I mean, it's no surprise. There's lots of really high quality vendors and people who are working in this space. But can you explain where you think like Nabla specifically differentiates itself from the others, and how do you envision it standing out, in the future?
Mm-hmm. Yeah. So there is, I think, the differentiation today, and then the future roadmap. But so first, speaking about today, I think we have very, very good EHR integrations. As you know, if you're not working well with Epic, it's useless. Well, it's nice, but it's not really good enough. We worked a lot on that from the early days designing the product. We already knew that it would be an add-on to an existing system, typically the EHR, but there may have sometimes other tools, and we need to be a good team player with these things. We are not here to replace the EHR. And so we need to redesign the product with this in mind, and start working with EHRs very, very early in the product when building the product. And so everybody's talking, is thinking about, okay, yes, you need to push notes to Epic, but actually there is much more to do. We should get context about the patient from Epic before the consultation starts. We can help with pre-charting. If a pre-chart has been already made, our job is to fill it. It's not to write a new note, but to fill the double asterisks parts in your pre-chart. So it needs a good Copilot, a good ambient AI. It needs to work really as a team with the EHR, and it's hard to do for many reasons. Sometimes you don't have a proper API in the EHR. Sometimes you have an API, but there is a lot of political work to do to work with them. It's a different culture, and so I think we invested a lot in this, and we are very flexible as a very engineering product-led team at Nabla. We are not afraid to do specific customization for every big customer, because there are no two identical instances of Epic. It's always different. I think even in your group, in your health system, Madam, you have like six different instances of Epic, and so we have to accept that it's messy. It's not a perfect world, and we need to be very flexible to have the right integrations and to adapt to the right workflow. We have to adapt our product. We cannot expect others to adapt to us. So and it needs a lot of engineering skills to build quickly these integrations and this customization. So this is, I think, something specific about us. We also very fast. We work a lot on the speed of the, as a physician, you must know, we are under 20 seconds of note generation, and we want the note to be generated by the time the patient leaves the room. The note should be ready. So this is the goal we set ourselves, and we will continue to take down this to 10 seconds, 5 seconds, and then real time. This is very important. We also support Spanish language for the US market. So consultation is in Spanish, but the note is in English. It works really well. And finally, we don't store. So, we come from Europe. We have very, very hard privacy data related laws. And we actually thought, okay, let's see the positive in that. So we don't store any customer data. Unlike I think all our competitors, it's a stateless machine. At the end of the consultation, we push the relevant information to Epic, and then everything is dropped. So we spent 3 years to build our own data set, so we don't have to use our customer data. And so it's easy to talk about privacy,
Yeah.
transparency, and so on. But then, what are you actually doing for it? And so we have a very radical answer to this question.
No, that's great. I mean, I think that gives a really good glimpse of that differentiator. And it's great that you guys have taken that approach. And like you mentioned, yeah, coming out of Europe, the privacy rules are even more stringent, than I think the United States. So that's a good mention. Now, I think something just to ask, this is my own curiosity, like is Nabla, is it suitable to even like a smaller group of physicians, or even down to the individual physician? is this a product that could work for that person as well?
Yeah, and I should have mentioned that maybe as a first differentiator. We from very early we chose a product-led growth model where we push a product directly to physicians, and then the physicians internally become our champions. If they work in a small practice, they can just subscribe by themselves and use Nabla in self-service. If they work for a big health system, they will eventually become champions and recommend us internally, and then we make an enterprise sale. This is what we've done several times in the US. And so it's a very, this PLG, bottom-up growth, is very common in other industries, like in CRM, for instance, or 85% of Slack enterprise customers are actually started self-service from a few users, and we are. But it's not really common in healthcare, and I'm a big believer. I prefer to invest in the product rather than in very expensive marketing and huge sales team, and who wants to see one more sales deck. So our strategy is to just push the product as early as possible to the physicians directly. But the fact that we don't store any data and we have very strict privacy rules makes it easier for them to try it without worrying too much. And it's free up to 30 consultations per month. And so we removed all the barrier, and then the product speaks for itself, and we rely on that. And so actually we do have lots of individual physicians as customers, and we started like that and then moved up to the health systems once the product started to work really well, owing in part to the feedback, the thousands of feedback we received from the small practices and individual physicians. So for instance, we are very strong in New Zealand, and I don't know anyone in New Zealand. I don't know how it came, but there was word of mouth, and so we have this big Nabla community in New Zealand that grew completely organically. But this is actually what we are trying to do.
No, that's super cool. I have not heard that, from any of these types of companies that are going that kind of, grassroots almost kind of campaign, which is very cool because, I think there's parallels in other industries of companies that have done that successfully. I think it's no surprise to people who know me that, I've been a huge Tesla fan for a very long time. And, and you look at Tesla and they have some product placement maybe in some movies or TV shows, but they don't advertise. There's never been a commercial. They don't sponsor, the Super Bowl in the US. But it's a word of mouth, halo effect, a spread, as I show my neighbor, they're like, this is amazing. And then, next thing they're ordering one. So no, that approach is super, super clever and smart.
And I'm sure you were active in Tesla, forums, communities early on. And this is exactly what's happening with us as a result of this go-to-market. We have hardcore fans, very, very active in the community. And as we move forward with our roadmap, we need their involvement. We cannot, you cannot innovate in healthcare out of the blue. So you can partner with very big institutions, but it's good and necessary in some cases, but it's slow. Or at the same time, you can partner with individual physicians or many people work for health systems, and then a few days a week in a smaller practice, they have a lot of freedom there. And so owing to this very close community that has been built around us, it enables us to move very fast now to deploy the future roadmap. So exactly like Tesla did.
No, very, very cool. So now if there's somebody listening right now, say a health system that a CEO or a chief medical officer or a CMIO or someone influential in a health system, if there's somebody listening right now that maybe has not heard of Nabla yet because they haven't been influenced by that Slack channel or someone else, mentioning it to them. If you had kind of like a 1 to 2 minute opportunity right at the shoulder of this person, what would you say to sell them to consider taking a look at Nabla?
I don't need 1 minute. I need 3 words. It's ask your physicians.
I love that.
I copied that from Twilio. Twilio. They had a very famous ad on the 101 in San Francisco for years. There was a huge Twilio sign on the 101 with only ask your developers and without any word about what they do. And it was very, very powerful.
That's awesome.
So what really we tell them is, ask your physicians if they know what is Nabla and they tried it. They will pitch you better than I can, and they are physicians. They have more credibility than I do. and if they don't know Nabla, take a few physicians in your group, ask them to try. With our PLG, you don't need anything. They can go on nabla.com. They don't even need to create an account. They can get started in less than 3 minutes. Well, in 3 minutes, they can have completed the first consultation and see the results. And this is enough typically to convince them to explore more. So we are really insisting on, instead of theoretical benefits and the pitch that you don't want to hear once more, we doesn't just spend 2 or 3 minutes with a physician. So the good thing is in these organizations, many of the leadership are physicians themselves. So they can even try by themselves, and we let the product speak.
Awesome. No, I love that. I really love that. Before we jump into kind of like some, what we call that nerd alert lightning round of questions, is there anything that you can share with the listeners, like kind of about the potential kind of future roadmap for Nabla? I don't want you to give away any proprietary ideas, but is there any nugget that you can give for people in that space?
Yeah. So I mentioned 2 things. The first is we are currently making Copilot proactive. So today it's just a passive device listening and then producing this note. What our physicians ask for is for the Copilot to, during the consultation, push some suggestions. In the first it won't be clinical, medical suggestions. Of course, we will need FDA and to do that later. But these suggestions may improve the quality of the consultation or the compliance or the billing, RCM to make sure it won't be, if you forgot something, maybe the payer will try to not reimburse. And so very simple, but I'm a big believer in the fact that a Copilot becoming proactive once you trust it will multiply in its impact. And this is an example of a feature we had in mind, but we didn't want to do before the users ask for it, because we knew that we needed to earn their trust before we start to, let's say you're a resident, day one, are you going to intervene in the middle of the consultation to say something to your physician? No.
Yeah.
After some time, in some situation, they may ask you to do it if you know something. And this is exactly, we will try to behave like a good resident, hardworking and polite. And so that's
cool.
One thing.
No, that's great.
But the other thing is the patient facing. So again, something that they are asking is, today we generate some instructions for the patient that you can send directly to the patient. It works really well. The patient loved that. It's very detailed and it's like normal language, not technical terms. We already see that, and we will do a proper study to measure it, but we see that it's impacting the treatment adherence, and also how they feel and eventually the medical outcome for patients. It can also decrease the size of your in-basket, messages that you get. We know you don't like to answer, to do this work. Most of these messages are not really medical and valueless. So providing patients with very, very clear, detailed instructions after the visit can decrease this burden.
No, that's great. I think there's so many other examples of that. What would I call it? Like going from the clinical kind of assessment to the action items that a patient, needs to be aware of. I think a lot about, we handle a lot of results, too, from the in-basket. And typical workflow is you open it up, and if it's your patient, you kind of know why you ordered it. But if it's not your patient, you're covering someone else, you have to look at the visit note to understand, okay, what was the context? Why'd they order this? And then you have to document, your assessment of it. Like, okay, this is abnormal. And that part's usually in very, it's in medical speak. But then there's always another box or some other way to communicate to the patient. And, you have to explain to them in lay terms. And, I'll be honest, this is where I've just played around even with ChatGPT, where I don't drop in patient identifiable information, but I drop in that clinical vignette that I've said, oh, this looks like they have cirrhosis and blah, blah, blah. They have some, kidney dysfunction. And I'll say these medical terms, but then I'll just say, translate this, for like an 8th grade reading level, in simple English terms. And it's amazing what these, language models can do. And so if once we get to that part where those things get automated, I mean, it's just, you're shaving off that administrative time and cognitive load, that nurses and other physicians and clinicians, need to do to kind of document, but also translate. So that's great. I love that. I love where you guys are going too. All right, let's shift to this nerd alert round, because I think this is kind of fun to find out a little more fun details that aren't specific to your amazing AI track record and history. But so first question, if you could vacation or live anywhere in the world, where would that be and why?
I would be a nomad. This is my dream. To have nowhere actually, and everywhere actually.
Yeah, so no home, and no, that's cool. I know there was a couple physicians that I know that are in the tech space that they did that during COVID. They went nomadic. I mean, my brother-in-law, he did too. He and his now wife, they both work for Apple, and they could roam around. So they traveled all over the place. They were able to work, and now they're back in the mothership there in Cupertino. But awesome. Do you have a favorite vehicle or car or dream car that you think about maybe having someday?
Not really. I like my feet. I like to walk. I read Rousseau, Jean-Jacques Rousseau, a French philosopher from the 17th century, and he complained that there is a new way to travel in a horse carriage, and it's too fast now. They don't have to think anymore, and it takes 3 days to go from Paris to next door. And he said, "This is crazy. It was better when I was young. We had to walk. It was better. I could think." And so I feel the same actually.
Yeah, that's probably a very stereotypical American question, I think. I mean, not that there's not car lovers all over the world, but I do think there's some sort of weird infatuation with big, large, previously very loud cars in America. But no, that's awesome.
I actually, so I lived for 9 years in California. I owned the Audi Q7 over there, which is a normal car for you guys. And I fell in love with this car. So when I came back to France, I bought the same one. But in France, if people see me driving this kind of car, you will throw stones at you because it's not good. I just plead guilty on that.
Well, yeah, because that thing's huge compared to the majority
for Europe, it's so I caught this virus in the US, so it's not my fault.
Yeah, no, that's awesome. So next question: outside of this current company and role, do you have any other kind of big problem that you think is worthy of solving? And it could be with AI, but you've made this pivot in your career, from Facebook to startups and now to healthcare. But do you have any other big kind of thing that's in the back of your mind, kind of slowly burning as you're continuing to work on expanding Nabla that you think is a big worldwide problem to solve? So
one problem I've been thinking all my life is that it's very big and totally outside of my reach, but I answered the question, is the Israelo-Palestinian conflict, which is, and it's not new. I've been following this quite closely for 40 years. And if I could solve one thing in the world, and again, it's totally out of my reach, but and I don't see any easy solution, but this is the one thing where if I could do something, I would definitely. And it's for cultural and familial reason, but that's
no, that's just a very like humankind, thing to. If somebody could solve that, I completely agree. Yeah, I have a lot of friends and colleagues that have even been more intimately, personally involved by those conflicts over the years. And that's that one probably hits home to a lot of people listening as well. Now, the theme of this podcast is efficiency unlocked. And obviously we're initially going with this healthcare theme, but Dale and I don't want to pigeonhole this podcast into only about healthcare, because we think unlocking efficiency in your life is like a way to lead to better happiness and wellness and more fun. But do you have like an efficiency hack or something that you rely on today that if somebody took it away, you'd be like, I can't function?
So one thing I've been doing for a long time is when I get up in the morning, my rule is for 1 hour, my first hour in front of my computer, I don't read any email, any message, anything. And so I can spend this time, reading or working on something or setting the priorities for the day, for the week. But I don't want to have any incoming information at this time. Otherwise, the risk is your priorities become the priorities that other people push to you. Mm-hmm. And your email inbox is nothing but that. It's your other people telling you what to do. And I think the best recipe to feel overwhelmed and then run everywhere and do urgent things but not important things is to follow just to work as a machine processing incoming stuff. And so I think the first, I take 1 hour per day, starting to work before I get this, and then I ingest this information. Of course, you cannot ignore it. But since I do that, I feel I'm doing more important stuff as opposed to urgent stuff, and you need the balance. But this is how I solve the balance.
No, I love that. How long have you been doing that?
Maybe 10 years.
Wow. Did someone give you that idea originally, or did you just come up with that? I'm actually super interested in implementing that myself.
No, it started like I think it started by myself. I felt okay. I really don't want to open my email inbox this morning.
Yeah.
I know there are bad things here. Let's start and then we'll see. And then they say, well, actually it's better. And so some people do variation of that. They read their email like 3 times per day. Only once I'm started in my day, I need to see messages. I don't do that. So there are variations, but I think everyone should think about how they balance external signal, incoming signal with their own priorities, and are their own priorities clear enough? Otherwise, if your internal priorities are very messy and not expressed, and other priorities are well expressed and pushed on you, then they will win, and you will never achieve what you really want to achieve. And it starts with small achievements, but maybe at the end of your life, there is a big achievement that you do or not because you missed all the small ones. So I think it can have a very big impact over the years.
I love that advice. That's great. Let's see here. There's a couple more questions, but I want to be mindful of time as well. So let's do, this is a little bit like doom and gloom, but like, is there a technology or a concern that you have in the future, like not being able to be kind of contained, or something that could just become a containment issue in the future?
Yeah, so one of the things I'm the most concerned with is the fact that with technology, some bad actors can really influence people. We've seen that already since even starting with the 2016 elections in the US with the Russian interference to push Trump. And we'll see more and more of that. And I think this is really dangerous because the weapons these bad actors will use owing to AI will become more and more efficient. And on the other side, the power of our democracies that is the fact that everybody is voting. It's also a weakness because if you can influence more than 50% of the people, then you decide for the vote. And if you can decide for the vote, then you can control the country. And so, for instance, I'm talking about politics today, was not the plan, but sorry.
Yeah, it's okay.
If I were Putin, can you win against Ukraine with US support? No. Maybe the fastest way to victory for them is to make sure the next president in the US doesn't support Ukraine. And so you'll work on that and get the guy you want elected, and then you win this war. And more generally, I think this is I'm very concerned about this weakness in our democratic systems, that it's quite easy actually to influence people one by one, and it's the weapons that AI is giving is becoming very, very powerful. If we don't use the same weapons to protect against that, it will be catastrophic. So this is my main concern, personally.
Yeah, no, that's exactly, I've thought about it in that sense, but you think about a lot of those things in this technology and just technology in general. When things first come out, they're super expensive. They're not attainable, and then as time goes on, the technology gets cheaper to produce, more accessible. And so, it's this constant battle of the good actors versus the bad actors. And I mean, that's no different than what's happened for centuries, for humans. And I think that's a key point to keep in mind with all of this excitement around this, that there is that potential for these amazing AI-based technologies to get out of control. And we'll just have to have the smarter people working on the good ways to combat it.
And it's a matter of education, making these technologies open. I don't believe that if you close everything, it will work. The bad actors will always find a way. So I'm a big believer, unlike OpenAI or people like that, I'm more on the Yann LeCun camp, that the more open it is, with good education, and this is a solution. So we could talk a long time about it, but that's
that could be a whole new episode. No, that's awesome. What if any of the listeners want to get in touch with you, Alex, what is your preferred method or mode?
Email alex@nabla.com, NABLA.com, and if you want to try the product, it's also nabla.com. It takes 2 minutes.
Perfect. Yeah, I love the name too. Well, Alex, I really appreciate you taking the time today to join from across the sea. And it's amazing that we can do these types of things and be so separate in the world, but feel like we're right next to each other. And I just appreciate you, your perspective, and also, what you've been doing and trying to make an impact, on healthcare on a worldwide scale. So kudos to you and your co-founders and everybody else that's working towards that mission.
Thanks very much, Adam. Thank you.
You're very welcome. Have a good day.
Thank you for listening to Efficiency Unlocked, Nerd Tested, MD Approved, a Nerd MD's podcast by Drs. Adam Carewe and Dale Gold.